In their 2018 budget, the federal Liberals made news by promising to introduce a national Pharmacare plan. They appointed a panel, led by former Ontario Health Minister Eric Hoskins, to figure out how to implement a system that would make sure no Canadians went without their medications because they couldn't afford them.
That too many people are falling through the cracks. The current system is inadequate.
But how does Canada's system for paying for prescription drugs work today? And how might national Pharmacare change that? Right now, the Canada Health Act, that's the federal legislation that ensures healthcare is publicly administered, comprehensive, universal, portable, and accessible, only applies to medically necessary services offered in hospitals and physicians' offices. Prescription drugs taken at home don't count. That's a big gap in Canada's healthcare system. And so, over the decades, provincial governments and private insurance companies have tried to fill that hole. On the government side, prescription drug coverage varies widely from province to province. But as a rule of thumb, most places offer some coverage for the very poor, for seniors, and for patients with catastrophic drug costs. Those are bills so high that no middle-class Canadian could hope to pay them. On the private side, many Canadian workplaces offer benefit plans that cover some or all of employees' prescription drug costs. What happens to Canadians who don't qualify for government coverage and don't have jobs with benefits? They have to pay out of pocket for their prescription drugs. There is some debate about how many Canadians actually pay out of pocket, but the advisory panel led by Dr. Hoskins said that about 20% of Canadians, or more than 7.5 million people, are either uninsured or underinsured. That means they have some drug insurance, but not enough to cover the full bill for all their medications. So how might a national Pharmacare plan change all this? Well, that depends on what kind of plan Ottawa and the provinces adopt, assuming they adopt a plan at all. Broadly speaking, there are two roads Canada could go down. The country could take what is known as a fill-the-gaps approach, in which Ottawa and the provinces would find a way to cover the remaining patients who can't afford their medications without dismantling the existing system. The fill-the-gaps approach is generally favored by pharmaceutical companies and the private insurance industry. They say there's no need to blow up a system that works well for the millions of Canadians who are fortunate enough to have robust workplace drug insurance. The other option would be to adopt a universal, single-payer Pharmacare program in which prescription drugs would be treated like hospital and physician services. Wave your health card and you would receive your medically necessary prescription drugs free of charge. That approach is generally favored by fans of government-run services, groups like healthcare unions and some activist and academic groups. The advisory panel led by Dr. Hoskins came out strongly in favor of a universal, single-payer system when it released its final report in June of 2019. How much would a universal system like that cost? Well, if the whole tab were shifted to the public purse, as the Advisory Council recommends, governments could eventually expect to spend about $15.3 billion more per year than they do now on prescription drugs. That is because governments would be paying the part of the bill that, right now, is covered by private insurance plans and patients who pay for drugs themselves. But overall, the advisory panel estimated that national Pharmacare would actually save $5 billion per year by the time the plan is fully implemented in 2027, largely by harnessing the power of a single government buyer to negotiate lower prices on brand name drugs, enforce wider use of cheaper generics, and limit the number of different drugs covered. That estimated $5 billion in savings would be a savings to all types of payers: governments, private insurers, and Canadians who pay out of pocket. The Advisory Council is urging the federal government to pick up the entire $15.3 billion incremental cost as a way of convincing the provinces and territories to join a national Pharmacare plan.